So generally the report, I mean, each patient explained the imbalance of vertigo in a different ways. Some may report it as quite spinning, and some of them they feel like they are rotating, and some of them explain it as the environment is spinning.
So that means your experience is objective vertigo.
Objective vertigo, that's right.
But what about imbalance?
General imbalance patients have come across. So some of them, it depends on, we need to perform different tests to rule out either it's a peripheral condition or it's a central component. Yeah, it's been almost over a year since I've been using this chair for the vestibular rehabilitation therapy purpose.
How many patients you have?
So till now I've seen about nearly about 65 patients, I could say. Yeah, I would say overall maybe 80 to 90% of the population, the patient population, have benefited by using this kind of rotatory chair therapy. So we used to see most of the patients who come across vertigo conditions, and 50% of patients who have come here, they underwent medical treatment as well. So simultaneously, for some patients, we've been using this chair for therapy purpose. So some of them, they are purely benefited by medicines, and I would say it's at least 60% of population who have not underwent kind of medicine, basically who has not taken medicines, they have benefited from purely from vertigo chair therapy. I'm into vertigo vestibular rehabilitation therapy since over 15 years, since after my Master's of Science degree. And over there at abroad, we have not been using the chair. So instead, like Kautan Cook say, exercises and different maneuvers to treat vertigo. So in that way, we have been using that approach to treat vertigo patients. And this is a kind of specialized chair. It's a really good kind of tool which is used for to treat vertigo and dizziness patients.
So
I've come across this kind of chair in France and Germany as well. So where they use for vestibular rehabilitation therapy. Yes, definitely I would recommend for other audiologists to go for this kind of chair. So mainly to treat vertigo patients in terms of like, adaptation or habituation technique can be employed along with this chair.
How many days of therapy you are advising?
So I would advise for patients if they can come every day for half an hour session, at least about 2 weeks. And depending on their condition, I would go extend the treatment maybe for 20 sessions approximately. Okay. So I would advise maybe once in about 3 weeks for a week of sessions.
Correct.
So where central compensation and adaptation would take place. So, and generally after the therapy, I would go through a kind of questionnaire called dizziness handicap questionnaire. So I fill it up, I do it pre and also compare with the score with the post therapy and compare the treatment effectiveness, and also I would perform craniocorpography, so to check if there is any sway or kind of a self spin. That's correct. We go through a set of investigations like CCG, craniocorpography for vestibulospinal reflex, and then also vestibulo-ocular reflex, VNG I do, video nystagmography, and also this is a kind of good diagnostic tool, this kind of chair, which is used to rule out bilateral hypofunctioning. So, yeah, this is not much expensive, and also the number of patients we come across, so can be dealt with, and I'm sure recovery can happen quicker in terms of money, the cost wise as well.
Thank you very much.
Okay, sir.